Over in Douglas, the only hospital serving that border area has shut its doors permanently. Cochise Regional Hospital lost its Medicare funding because of what the government says are serious deficiencies. They could not operate without those funds. The doors closed on Friday. 9 News Side's Keaton Thomas joins us tonight with how this affects emergency services in Douglas. Keaton.
Well, good evening. So this closure means the next closest emergency room is in Bisbee. That's about 30 miles away from the 20,000 people who live there in Douglas, and that's an extra 30 miles. It has an effect on the fire department transporting patients. In just a few hours on Sunday afternoon, 3 ambulances transported patients to Bisbee's Copper Queen Community Hospital from Douglas.
Closest hospital with an emergency room.
Yep. Lieutenant Matt King is with Douglas Fire. He says one effect of their hospital's closure in Douglas, the Bisbee Hospital is about 20 miles from Cochise Regional and about 30 miles from Douglas. That means about 40 extra miles round trip for the fire department's 6 ambulances. It's part of the reason they're looking to increase their fleet to 7. But the main effect on the fire department,
it's just going to be longer till they get to that definitive care at the hospital.
Michael Starr is a paramedic. Things are a little different now for him.
We have to make a critical decision.
That's either fly out the patient on a helicopter or make the longer drive to Bisbee.
If we have a patient that's unstable, whereas we only had to be with that patient for 5 minutes before, get them to the ER, and they could work on stabilizing them, you have an extra 20 minutes that you have to manage that patient now. So a lot of things can change in 20 minutes.
The fire department even increased their normal staffing because of the longer transport times, but they want to assure their people in Douglas that they will be there to help.
We're not just going to leave people hanging. We're going to take them to the most appropriate closest hospital.
And this seems to be a trend as well. In the past 5 years, 54 other rural hospitals have closed in the United States. Many rural hospitals actually get more than half of their funding from Medicare, and so losing that can prove devastating to those hospitals. Live in the newsroom, I'm Keaton Thomas, KGUN 9 on your side.